Hello, and welcome to Wellness Wednesday with Dr. Marcia Perretto. My name is Patrice Rogers. I'm Director of Operations at Actify Physiotherapy and Wellness. And we're kicking off our Wellness Wednesday online with this meeting. And we are trying to record this for the first time so that we can replay it and send it to everyone that has been here and people that could not come. So bear with us as we learn how to do this. I want to start out by just letting you know that the information presented in this meeting is provided for educational purposes only. It's not intended to serve as medical or nutritional advice. It should not be used as a substitute for professional guidance. The attendees are encouraged to consult with their physician, nutritionist, and/or dietitian to develop a personalized nutrition and health plan that meets their unique needs. Good Living Habits, DBA Actify Physiotherapy, and Dr. Marcia Perretto cannot be held liable for any health issues, adverse reactions, or outcomes that may arise from following the information presented in this session without the supervision of a licensed medical professional. Please use this material as a general guide and seek individual advice before making any changes to your health or dietary practices. And now I'd like to introduce Dr. Marcia Perretto.
Hello, everyone. Great to be here with you and kickstart our first Wednesday, Wellness Wednesday. I think it's going to be a cool way for us to review good ways to keep us healthy, exchange information, and hear more from you guys as well on the topics that interest you. So today we are going to just go into a couple topics that we have had more questions, and we welcome you all to go ahead and um, ask us in general, send us questions that you would like us to discuss and present. So um, today we're gonna start with talking about nutrition for inflammation, right? I think that's the biggest thing that I see a lot of patients having a lot of issues with. I have had my own challenges with inflammation, and I also have been able to observe through the different diets and the different things that I have eaten. How that impacted my body. So I have a pretty extensive nutrition education. I started learning these things for my own benefit initially because, as you all remember, I have had my share of challenges and disability. And so I had to figure this whole thing out and how it worked for me. And just remember, what works for one person will not work for another, might work somehow in pieces and bits for a third person. So we are all different and unique. So we all need a personalized program. We all need things that work only for ourselves. But as a general rule, if we look at anti-inflammatory foods, we should be emphasizing whole foods, meaning fatty fishes, leafy greens, berries, and nuts. And remember, again, when we talk about berries, when we talk about nuts, when we talk about fishes, we need to remember some people will actually have issues with food sensitivities and allergies. So please pay attention to what you're sensitive. Just because something is healthy does not mean it will fit well for your needs, okay? But in general, an important guideline is uh, 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 the, let's highlight the importance in between the processed foods and the inflammation, right? I think this is a huge thing that we all need to do. We need always to eat really fresh, whole foods over processed options, including plant-based milks. Plant-based milks are good, but there's a lot of processing going through those plant-based milks. So a lot of them are high in preservatives, additives, and recent research actually suggests that they might be correlated with the risk of colon cancer. So we do recommend, and I strongly do recommend that you minimize these selections and always aim for the higher quality. So go to that label on the back of that milk. Remember the app Yuka? I have mentioned to a couple of you. Yuka, Yuka, is an app that when you download, you get to scan the barcode of the food you're buying, and most of the foods they're processed are in that database, and they're adding foods daily. Uh, Scan it, it will be able to know what is in there that could be damaging for your health. But also remember that you have a specific needs, right? So, also when you deal with plant-based milks, think that you might do a almond milk today, but you might want to go to an oat milk in the following day or a couple days later. So, and for those that are not allergic to dairy or extremely intolerant to dairy, uh, please introduce mindfully some dairy here and there. Some of us will do really great with dairy. Some of us are not going to do well with dairy. Some of us are intolerant to the protein of the dairy. Some of us are intolerant to the lactose. So we need to kind of find where we find ourselves. I found that I can have a little bit of dairy and it's not an issue, but I cannot have a lot of it in one sitting or in one day or in many days back to back. Um, there are some specific nutrients that are extremely important for the inflammation, like anything that has omega-3 fatty acids, right? So let's focus on omega-3 fatty acids, antioxidants like vitamin A, C, E, and even the polyphenols. So those are extremely healthy. They will foods that contain those are going to be very helpful. We're going to be going over a couple things in a little bit of what is healthy, what is not. Okay. Um, what else? Some practical tips that I want to give you guys is always mix, make a meal or a snack that incorporates anti-inflammatory foods, which means that, uh, like for example, a smoothie with berries, chia seeds, leafy greens, a kale chips homemade. You can make it yourself. You add a little salt on it, a drizzle of olive oil. That has your healthy fat, that has your leafy green, and that has your sodium for your POTS symptoms for those that get challenged by POTS. So think about things like that. Introduce always a protein. We do need proteins and proteins from uh, animals versus proteins from vegetables are different and they act differently in our bodies. Okay. Um, and obviously, some of us have preferences, some of us have intolerance to protein. So let's obviously stay within what we consider safe and feel comfortable. Some of us have issues with textures, so we need to remember that, right? All these things are important, but in general, when you go to the grocery store, aim for the round circle of the grocery store, right? And go to the greens and fruits and vegetables area and only go into the aisles as needed for the minimum necessary things to cook. Okay, so like let's say you want to get a green, you're gonna get, like some beans, avoid canned beans, avoid things that are highly processed. Let's always try to make it as fresh as possible as we can because then we also get challenged by the excess of activity draining us, right? Being tired from work, all those things are also a challenge for all of us. So be mindful of what you can do and do what you can as healthy as possible. All right, we're going to be breaking this down on other Wellness Wednesdays and more tips and things like that. Let's talk a little bit about nutrition for POTS as well, right? Because you guys will see that once you start improving the inflammation in your body, your POTS symptoms might start responding better as well. But for POTS specifically, we also need to think about hydration, right? Or in hydration with electrolytes or that saline solution type of drinks, right? Or IVs even. I mean, I get my IVs 2 or 3 times a month. But we do want to make sure that we do get some sodium, some potassium. some trace elements. There's some specific drops you can buy on Amazon if you just Google or search on Amazon trace elements. That will be beautiful. You're going to find is a little droplet, great thing to help with improving your cellular balance. Your salt intake, okay, is essential. Now, some of us have regular POTS, which we either have a low blood pressure uh, or steady, low and steady blood pressure. We drop a little when we stand, but it's our heart rate jumping up and down. Some of us have hyperpots or hyperadrenergic pots, right? In that case, you need to be a little more careful with your salt intake as well, because your blood pressure will increase when you stand up, and your heart rate will increase as well. So we need to kind of see, okay, where am I? Is my physician aware of it? Am I medicated? So that is a consideration to be taken with your physician a little separately. But overall, all of us, or as a majority, will have traditional POTS, postural orthostatic tachycardia syndrome, and we need to increase that isotonic hydration and so we can stabilize our blood pressure and we can maintain the volume of fluids in our bodies. Okay. So, some snack ideas that I love and I carry with myself: nuts with salt for those that can have nuts. Some of us are intolerant to certain nuts, can have others. So, if you mix nuts with dried fruit, you get the sugar or you get the potassium, you get the other nutrients from that dried fruit and the nuts with the salt. Now, be mindful one thing, anything that's dried has a higher concentration of sugar. Sugar can ferment in your stomach. If you have a sensitivity to fermentation, you gotta kind of be careful a little bit with that. So that's always, as I say, everything in moderation. Don't do the same snack every day. Like I really like the jerk meat, the healthy ones. I do have a little piece during the week here and there. uh, one day I will have nuts with dried fruit. The other day I will have a little piece of cheese with some uh, nuts as well, or some other sort of dried fruit, or some hummus with some very healthy type of cracker, gluten-free as usual. And that's actually a point I haven't mentioned. Gluten is inflammatory, so it's as much as we can stay away from it. And by that, I mean do not eliminate unless you have celiac disease. Do not eliminate unless you're extremely intolerant. Why I say that is because if one day you get anything that has been cross-contaminated and you have been gluten-free for a while, your body might react a little more um, strongly to that. So you don't want to eliminate completely. What I like to say is eliminate refined gluten forms of foods, right? So stay away from that pasta, stay away from that bread, and replace it with things that do have a whole grain that has gluten. But for those that can, remember, but don't make it also an everyday thing because too much of something can cause a buildup and a sensitivity or an intolerance. So spread things, vary your foods, change it around. Okay. Um, Another tip for the POTS patients is more like frequent and balanced meals. And remember, we're talking about inflammation and POTS, and then we're going to talk about mast cell, but all separate. Think about all this having to coexist, right? Because a lot of us have all three. Some of us have even other issues that add on to that pile, okay? So let's make smaller meals so our stomachs can digest, more balanced meals. Make sure there is a protein. We do need a protein so your connective tissue and our muscles can actually develop health in a healthy way and heal, right? Try to go more for complex carbs, but don't go for raw foods. Raw foods are harder to digest. If you have issues with your stomach, you might be putting yourself to a little bit of a challenge digesting that food. So again, each one of us is different. You might be able to eat broccoli, not be able to eat cauliflower raw. So find what works for you. Okay. And so the idea of that small balanced meals is so you avoid a blood sugar fluctuation. And when you also do more of complex carbs, it's going to help you not to have those drops in sugar after you had that pasta bowl where you have that hyper sugar, and then once that sugar metabolizes, you have that drop, and you are like desperately looking for something sweet because you have no energy left. And carry small snacks, little bags with small snacks. You can reach into your bag. I separate my bags, my little snack bags on the weekend. I make them, I sit around, I just make them my little bags and I carry with me wherever I go. And I walk around with my big, nice jug of water because I want to make sure that I am hydrated, but not only water in here. I personally prefer to make my own saline solution. I don't do well with all the saline solutions. They're store-bought. They cause me very much of an upset stomach. So in a bottle this is a 40 ounces. I will put a half tablespoon of sugar, quality, non-refined raw sugar, and a quarter of a teaspoon of salt. I use Celtic salt. I prefer Celtic salt. Okay. Sometimes I do want to add some fruits in here. Sometimes I don't put the sugar and I just add the fruit. I can put some strawberries, mash it. I can put um, even cucumbers, they taste delicious because you have the salt in it, kind of gives the little salty kick. I prefer salty things, not sweet things, but I do need that sugar to help me keep my blood sugar stable. Any fruit in there, peaches, you can crush an orange. There are even special bottles where you can put that fruit and it stays separate in a container. Just make sure that the recipe I'm giving you is for about 40 ounces, 34 to 40 ounces of water. So it's a half tablespoon of sugar if you're doing raw sugar. Any amount of fruit you want to add with or without the sugar, and then the quarter of teaspoon. Um, Another way for you to find out, because in 1 tablespoon of sugar, you have approximately enough sodium for the day. I'm sorry, 1 teaspoon, not tablespoon. Rephrasing the whole thing. Just got my brain backwards. 1 teaspoon of salt. You have enough salt for sodium for the day in there for most of us. Some of us might need 1.5. Okay, I have seen people that need 2 teaspoons of salt. So start slowly and build slowly based on how you feel. Monitor your blood pressure to make sure you're not giving yourself high blood pressure from too much sodium as well. But do not just drink water because you may water down your electrolytes a bit too much. Finally, let's talk about nutrition for POTS. I'm sorry, for mast cell. Okay. When you have mast cell, now we are looking and you have EDS and inflammation, and you have POTS, and now you're like, oh, great, I have mast cell too. So you might want to look into a bit of a more low histamine foods, right? Um, Histamine forms out of foods after you keep them in the fridge for too long. So for a long time, I was guilty of thinking I was beating to the chase of my fatigue by cooking for 3 days and keeping it in my food in my fridge. And then I found out that I was actually allowing my food to release histamine. And then I was eating, and I ate the first day, it felt great. I ate the second day, I was like, okay, that kind of feels funny, but all right. The third day, I would have a reaction. And I couldn't understand because it was the same food. But of course, as I researched more, as I learned more, I became more proficient in everything that I do. And I've been doing this for 12 years now. I learned that foods release histamine when they're stored. Okay. So we want to avoid storing foods pre-cooked. You want to cook your food. You can have it there for about 24 hours, tops a day and a half. Didn't eat it, throw it away. You bought store-bought food, eat on the day or out. Store-bought food, we already don't know how long it has been sitting there, right? We're already taking a chance there. So do not put it back in the fridge and reheat next day. You're certainly gonna get heat with the pretty significant amount of histamine from that food, almost as a rule. But looking to fresh meats, I personally prefer brown rice and I look for organic grains every time I cook grains. I have a pressure cooked pan and I cook my grains there. Um, I love mostly all leafy greens are my favorite, but I do avoid aged cheeses and all fermented foods. Fermented foods will bring us a great deal of um, probiotics in general, but they also will cause some reaction, some sort of reaction. So if you eat something fermented, it don't feel good, you already know that that's not for you. Um, Other anti-allergy foods and supplements that we can look at, like anything that's high in quercetin and vitamin C. So you can definitely add on your quercetin and your vitamin C separately, but you can also eat things that are like, for example, like apples, broccoli, anything citruses is excellent. Then you might say, well, but I can't do broccoli because it's a high FODMAP and I don't respond well. Did you try that broccoli in a different way of cooking? Okay. So I personally cannot eat raw broccoli. I have to go ahead and either roast my broccoli or steam my broccoli. Now, I also realized that that's the funny thing that as you pay attention to what you're doing and you're in tune with your body, you realize that I realized that when I broil or roast my garlic, my take the garlic away, put the broccoli back in the conversation. When I roast my broccoli, I still don't feel as great as I feel when I steam my broccoli, right? But I also learned that if I season my now let's bring back the garlic. If I season my broccoli with garlic, doesn't matter if I steam or I roast, I will not feel well. Okay, and that goes into the FODMAP diet or guidelines. And I don't vouch for any specific diet per se, other than an anti-inflammatory way of living, unless you have a proven diagnosed disorder that requires you to go through an elimination process and a reintroduction process after you heal your gut. If you eliminate something, you don't eat anymore, your gut does not produce the good bacteria that will digest that. Once you have it again, your gut is going to go like, wait, what? I don't know how to digest this. And you're going to have you may have an initial issue digesting that food. So only eliminate something and reintroduce either under the supervision of a licensed professional that can help you with that and based on a official diagnosis of it. And if you're celiac, for example, then you definitely have a lot of restrictions. So just keep in mind, we're not supposed to be restricting things. We're supposed to eat in moderation, a little bit of everything, because everything that we eat has a meaning in our lives. Okay. So, again, emphasizing the importance of the fresh meals, right, as much as possible, uh, to reduce the histamine buildup and rotate foods to avoid reactions from overstimulating your body or overpacking your body with that one type of food. Um, by your quercetin or quercetin, I have heard different ways, not sure how to pronounce that at this point. Uh, and vitamin C of from a very good and reputable company. Don't go based on price, but also don't believe that the most expensive is the best. Okay. So, for example, Thorne, Thorne, is a very good company. It's one of the companies I like, but there are others that I also like. So, if you guys keep asking me, I might change my mind a month down the road because I found a better one. Um, but I would definitely make quercetin and vitamin C along with the B12 methylated and a B6 complex to be essentially part of my daily, and omega-3, if you don't eat enough fishes, omega-3 to be part of my daily supplementation. Okay. And again, high quality. And trick for the omega-3, if you get one of the tablets and put in the freezer, if it 24 hours later it has not frozen, that's a good quality one. It has frozen, take it back to wherever you bought it from, because that is not a good quality one. Okay. So for those that want to, let's talk a little quickly about the apps that I kind of like and I use for myself sometimes to figure out what I'm reacting to or not. Monash University has an app called FODMAP. FODMAP it has a little wiggly, I call the wiggly squiggly intestine drawn design on it. It's blue. I like that app because it does give you the six sugars broken down. It tells you how much you can eat, and it still should be at a safe level. Remember, safe is dependent on each one of us. I know how much I can have of each food, and sometimes doesn't match the app. And also, for example, a good example is a asparagus. I learned from playing with the app that my reaction is on fructan and not on fructose. Asparagus is rich in fructan and fructose, but it has a lot more fructan that it has fructose. And I learned that for me, when I eat too much asparagus to a amount that builds in fructan, I will have a reaction. And I said, oh, I'm confused with that. Bear with me. If I season my asparagus with garlic, garlic has fructan, asparagus has fructan, I will react. I don't react if I only have the asparagus. Okay. So I learned that. And I know how much of the spear, how many spears I can eat without reacting. So learn it. Eat two. You didn't react, great. Try three next time. If it didn't feel that great, it's your limit is about two. The other app I mentioned is the Yuka, Yuka, which tracks ingredients, it flags additives, food colorings, things like that that may be histamine triggers and may be pro-inflammatory. And there's another app called Flare Down, which tracks symptoms. That you can track your symptoms, your diet, potential triggers. It's for patients with mast cell or POTS or both. Um, so those are my favorite apps. Um, and I think I have covered. I try to cover as much as I can here with you guys. We're going to be looking again into details and breaking down things like that. So I think from now we will be taking some questions. Um, Patrice, do we have any questions coming right up?
Yes, we do. The first question we
Okay.
have is about the uses of turmeric for different people or different conditions.
Okay, great question. I personally love turmeric. I feel like it's one of the supplements that has made a difference, significant difference in my life in terms of pain and inflammation. Uh, Turmeric has extensive uses in cancer. It's an anti-inflammatory. It helps boost the immune system. It helps with pain management. There are research papers that point it to be equivalent to taking ibuprofen. Um, it helps with digestion, improves brain function. It helps with cardiovascular disease. It Going back into pain, it actually acts in joint pains significantly. There's some studies pointing it to be good for Alzheimer's disease, helps your mood, boosts brain health. It actually has a direct effect on arthritis, helping to decrease that joint inflammation from the wear and tear. And there's even some research pointing on turmeric being a good option for patients with depression as well. Um, the doses are in between 900 and 1200 milligrams a day. Some of us can have to take it broken down three times a day. with a meal. I do not recommend turmeric to be taken without a meal because it can be strong on your stomach. You can also use it for seasoning foods. Just don't put that like teaspoon or half quarter teaspoon in in the big bowl and divide it. I mean, of course, you want to divide with your family, want everyone to have good benefits, but you need a certain amount for yourself. So make sure you are allocating enough turmeric to your diet on daily basis, and cook with it. Um, I know that there was a concern in regards to turmeric being a blood thinner, and it's relative. Turmeric it can act as a blood thinner in high doses, okay? So the active ingredient in turmeric has curcumin, which is an anticoagulant, uh, which helps prevent blood clots. Now, it's kind of that double thing, right? Some of us have issues with microclots. Bingo, that's a point. Um, but for those that are taking blood thinners and then taking turmeric, talk to your doctor, okay? Because you need to know if you're gonna be okay based on the dosage of your like warfarin or Plavix or even aspirin, and find out if you might have to peel back on the amount of that turmeric. Or your doctor might say, you know what, take this and stop this other one, but only do this with the supervision of your doctor. Okay? Next question.
Next question, will nutrition affect joint pain?
Oh, yes. Nutrition affects joint pain by decreasing inflammation as well, right? So omega-3 acids can reduce inflammation and stiffness, and they are rich in fishes, nuts, plant-based sources like flaxseed oil and ground flax. Um, Eating a variety of anti-inflammatory foods, definitely, there so many research, so many research papers pointing how we can reduce joint pain. And Mediterranean diet is a great example of an anti-inflammatory diet that is rich in whole foods like fruits, vegetables, fish, nuts, beans. And again, when we're talking about beans, we just go out of the can and into the grain as healthy as possible, avoiding then the refined flours, as I spoke earlier, avoiding fast foods. I mean, we well know how many chemicals on those fast foods we will be finding. Do not go for that. Refined carbs are not good. Red meat in moderation is excellent, but if you look at the pyramid of the Mediterranean diet, red meat is right away on the top here. It's mostly rich in fishes and lean meats, right? The red meat is up here, but doesn't mean we shouldn't eat unless you're having issues, tummy issues that has to be looked at. Avoid trans fats, saturated fats, sugary foods. All this contribute to joint damage and inflammation. And for those that are vitamin D deficient, uh, vitamin D deficiency can cause muscle pain and joint pain. So please, if you're not hitting like the middle point of the vitamin D number that you should be, if you're like, oh yeah, you're low normal, that is not good. Let's jump to that half to three quarters of that level of vitamin D. Okay, so discuss with your doctor again, high quality source vitamin D. Okay. What else? If you need to identify foods that could be causing you inflammation, again, just eliminate the inflammatory foods that you know you're taking. Give yourself 30 to 60 days and then reintroduce those foods, one food every week or two. But that does not count reintroducing the donuts, the McDonald's, or the Burger King. Let's not be play favorites here, or any other artificial foods. That is only for foods that are healthy and in whole form. All right, what is next?
Next question, do you have any suggestions for meal delivery services?
Okay, so meal delivery service is really a hit or miss. I have done different ones. Okay. I always aim for the ones that are mostly um, gluten free. I try to go for that. Um, there are the ones that they give you the ingredients and you cook at home. And then there are the ones that they are going to cook for you. So, Home Chef, Hello Fresh, you cook yourself. Then there is Green Chef, which is a very good option as well. There's Factor, is a very good one. They're like 29. A Factor is actually one of the ones I really like is 29 plus dietitian design and chef crafted options, and they rotate the menu. So for us, it's excellent, and they have you get to pick certain things as well that you cannot eat and things like that. Then there's another one called Eat Clean, which also gives you like a 45 plus menu options weekly. And you can choose, that one can be diet specific as well. So you can choose keto, paleo, plant-based, or traditional. Um, what else? We also have another one, right, Patrice? Someone has recommended to us. What was that one?
Fresh meal plan in Boca.
Yes, there's Fresh Meal Plan in the area of Boca Raton if you're around here. It's a company that also cooks, and we have heard good things. I personally have not tried. What is next?
Next, do you have any strategies or recommendations for vagus nerve sensitivity?
Oh, the darn vagus nerve. Okay. Yes, deep breathing. And by deep breathing, I don't mean like, because that is gonna end up when you inhale, you it's your sympathetic. When you exhale, is your parasympathetic. So let's rephrase not deep breathing, but let's talk about breath work, right? And the ones that have worked with us understand breath work. We want to not inhale as hard, but we want to make our exhale long. Now, if you exhale and you hum, you all can feel on your throat the vibration. Guess what? That vibration is massaging your vagus nerve. And that massage of the chanting, it can be Om, can be any chanting, honestly. And I know some of you are going to say, oh my God, I'm going to look like a weird doing that. Yeah, we are all weirdos. Okay, let's just do it. It is so good. I would be home by myself doing the Om and the chanting, and I would feel weird because my cats would be sitting and looking at me. I don't feel weird anymore because it just feels good. Okay. Uh, Massage. There are some specific exercise, dry brushing to the vagus nerve, some techniques of ball massage to the neck. For those that have worked with us, have learned some of those massage techniques. If you are working with us and you haven't learned, next time you come in the clinic, just say, hey, what is that vagus nerve ball massage, neck massage that Dr. Perretto was talking about on the video? We're going to make sure to teach you. Um, Gargling is so incredible. Just don't choke on yourself and be careful if you have CCI because you're going to be like right here, right? Gargling. That might be a little tricky. Meditation. And by meditation, I don't really mean that you have to just like be a pro in this. If you meditate for 2 or 3 minutes, when I worked at Holy Cross Orthopedic Institute, it was like patient after patient after patient after patient. It was just such a loud environment, it's so high paced. I would like go to the bathroom. I probably had 2 or 3 minutes in there. I would close the door. I would just literally just sit. That we had a little sitting area, like a little stool there, and I would just sit there and I would like, and just like maybe a little 2 or 3 minutes of bringing myself back into my body, into my roots, into my senses, right? Light music, but don't just do cool things like, oh yeah, I'm gonna be just only on this very quiet environment, we need to exercise. Sometimes we need to be out there, seeing nature. Wake up in the morning, go out there, let the eyes look up and see the sunlight. Don't stare at the sun directly, but look, let that sunlight hit your face, right? Get fresh air. Do your chanting or meditation sitting on a bench or on a chair outside on your backyard if you have one. For those that have the courage or even like already, ice baths are incredible to actually normalize the vagus nerve. And yoga is very good, but be careful. Obviously, not all of us can endure a yoga session or can even do by yourselves yet. We're not there. So, but just putting it out there. And fasting, trust me or not, uh, fasting can actually help with uh, regulating your vagus nerve. But these are more advanced. Like fasting is a more advanced. Uh, but the biggest one, I think, is practice loving kindness to yourself. Um, give yourself a nice love hug. Give yourself some time to unwind. And by unwind, I don't mean sleep. I mean sit with yourself in a quiet place and just be. Just get yourself the opportunity to feel your body, feel the sensations through your body, and just acknowledge them and accept them so you can move forward. I guess that's all I have. Do we have anything else, Patrice?
Just one last question about will nutrition help joint stability for HEDS?
So, nutrition will help joint stability for patients that are hypermobile in the sense that if you eat healthy, you will be able to build a better quality connective tissue. And I know I make bad collagen. How is that going to be? But bear with me. It's going to build better tissue health and it's going to bear healthy, it's going to be build muscle, help us build muscle. We can't exercise you and help you heal. Connective tissue heals by tension, application of tension, by application of tension over time, and by challenging that connective tissue, right? That those ligaments, they do strengthen. They just don't strengthen like muscle. Muscles will strengthen by exercising and moving. But if we don't have the building blocks to work with that come from the proper nutrition, then we are not going to PT. We can do as much as we want to do with you. We might be draining you, might be getting you tired. You might be sustaining micro injuries because you're not getting the nutrients. And by that, I mean that it could be that you're not eating the right nutrients, that you're not digesting the nutrients, or you're not absorbing and utilizing those nutrients. So it's not only about eating, there are other things that can happen. So I just want you to keep that in mind as well. And that's the importance of working with professionals that do understand EDS, professionals that understand the implications like not only of the nutrition, but nutrition and exercise, nutrition and post-exertional malaise, nutrition and delayed onset of muscle soreness, POTS and nutrition, POTS and exercise, mast cell and exercise, and all that big soup of symptoms and things that we need to know to live a more fulfilling life and feel good about ourselves, even thought we come with this little tiny faulty thing that is causing us a bit of a headache day in and day out. I guess we're done, right? We are out of time, right, Patrice?
That is correct. We thank you for being with us. We have a meeting here, a Wellness Wednesday meeting here on Wednesday, November 20th in the clinic. We've sent an email about that. But if you haven't heard about it or you would like to attend, we have room for 15 guests. Just call me 561-366-2435. And after that, the following Wednesday, the 27th, right before Thanksgiving, Dr. Perretto will be on Instagram Live with Jeannie DeBon, 12 noon Eastern Time. And we already sent one email about that, but we will send another reminder so you can tune in and hear questions and answers from two of the utmost experts from two different continents. So,
Yeah, and if you're listening to this and the time has passed and you missed our next meeting, just reach out to the clinic and say, hey, when is this? When is your next meeting? This could be January, February, March that you're reaching out to us. We have one Wednesday, Wellness Wednesday every month, and we're aiming for a in-person now. We're gonna have the in-person and the virtual. And Jeannie and I are planning on like doing also a little meeting every month as well. So there are several options for you to join us. Just reach out and find out. We'll let you know when the next one is. Great seeing you all. Thank you so much. Bye.